Retrograde alopecia is a under-recognized part of the male pattern hair loss, and frequently it is a big determinant on how much donor hair we can harvest from the patient. The retrograde alopecia starts around the ears and at the nape of the neck and works its way up, and you can lift up the hair and see where the miniaturization is occurring, and that miniaturization may extend quite high up into the hair and may reduce the area of permanent hair available for transplant. So in some individuals, retrograde alopecia severely limits the amount of available donor hair, and in other patients there is no retrograde alopecia. So it depends very much on the individual, and it absolutely will determine the number of follicular units available for transplant. I haven't spent a lot of time looking at this technique. I'm concerned about the texture of the hair, and I'm not certain that beard hair would provide the kind of cosmetic result that I like to achieve in my patients. So while I find it interesting, it really hasn't been of much interest to me in terms of my daily practice. Yes, I think that we will be providing FUE for certain patients in the not too distant future. We will have to make those patients well aware that their expectations in terms of a final result will have to be lower than a typical strip technique, and we will have to set guidelines as to which people are suitable candidates for FUE, and what the indications are in a particular individual. So I think we'll be doing it, but I don't anticipate it becoming a large part of my practice. In general, I prefer that a patient has a healthy skin prior to the surgery, and under ideal conditions we would not go ahead with the surgery if there was a dermatitis. However, frequently in practice we have patients that have traveled from across the world, taken a month of work, spent a large amount of money in preparing for their surgery, and the procedure is still possible, and I don't believe the dermatitis will affect the final result. It will simply take more care on our part, and post-operatively, perhaps with stronger antibiotics, to achieve the same level of result that we would expect with a healthy skin. So we prefer not to have it, but it's not unusual for us to perform surgery in the presence of dermatitis, simply because the logistics dictate that if the surgery isn't done now, there may not be a time in the future which would be so convenient. The A-cell solution is looking promising with regard to hair survival and regrowth. So, you know, I think that A-cell and future products like A-cell are going to be important in our practice. The best patient who we will dense pack on is a person who has naturally dense hair and only a small area of hair loss and unlikely progression of that hair loss in the future. So if a patient has high natural density, a small area that needs to be transplanted, and a final minor degree of hair loss, that will be the patient that will dense pack and try and achieve the same density as the surrounding hair. And with different patients, we can achieve different densities depending on the nature of the hair and the size of the follicular units that we achieve. But you know, for many patients, we can achieve 80 per square centimeter or more if necessary.